The danger signs of pregnancy. Many women have lost their pregnancies just because they are not cautious about their danger signs, or about the danger signs of pregnancy. In this video, we are looking at the danger signs of pregnancy. These are the signs, these are the features you should look at and run to the hospital, run to your doctor in order to save your baby.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room for yet another episode of Ask Dr. Othman. And I told you, if you'd like to get in touch with me to have a private chat, go to my website www.drothman.com, book an appointment, we shall talk, we shall discuss and probably chat a way forward for your problem. And if you'd like to get us, find us on all our social media platforms. The name is Ask Dr. Othman. We shall be there, we shall discuss. Today we are talking about something very, very serious. It's very serious because it can lead to the loss of 2 lives. I'm talking about the life of the woman or the mother and the life of the baby or the fetus. These are the danger signs of pregnancy. Why am I teaching these signs? Colleagues, I'm teaching these signs for you to learn them, to understand them, to be cautious when you get pregnant, to look at them, to check them. When you see any of them, rush to the hospital. When you see any of these signs I am going to talk about, go to the hospital, go and check with your doctor, check with your gynae, check with your midwife. These are the danger signs of pregnancy. Number 1 is bleeding or PV bleeding, pervaginal bleeding. If you are pregnant and you see blood, even if it's spotting, go to the hospital. What can bleeding in pregnancy mean? Of course, on a good note, it may mean implantational bleeding. That is the 2 weeks after fertilization. 2 weeks after fertilization, you can have some little spotting, and that will mean implantational bleeding. That one has no problem. However, if it's not implantational bleeding, let's say bleeding at 2 months of pregnancy, 3 months, 6 months, and so on, what can it mean? Number 1, it can mean a placenta previa. Placenta previa is when the placenta, what is a placenta? A placenta is like that substance. It is a structure where the fetus feeds from. The placenta is that structure that connects the fetus or the baby to the mother. It is that structure. It's like this. It's like a cord. Actually, there is a cord and something palm-like. A placenta is like a palm connected somewhere on a thread or a cord to the fetus. So a placenta provides a connection, a joint between the baby in the uterus and the mother. It's where the baby feeds from. It's where every activity, every nourishment, blood, and so on passes through from the mother to the baby. Blood circulation, what we call the fetal circulation, all happens at the placenta. Now, when this placenta blocks the neck, when the placenta blocks the neck of the cervix, we call that placenta previa, and it's one of the danger signs of pregnancy. So, when there is bleeding, rush to the hospital. My friend, rush to the hospital to provide or to safeguard your life and the life of our unborn baby. What else can cause bleeding is abruptio placenta. What is abruptio placenta? Remember, I told you the placenta is connected. The placenta connects the baby or the fetus to the mother, that is the uterus. Now, when the placenta, because it's like this is the placenta connecting to the uterus like that. So when there is separation of the placenta from the uterus, we call it a rupture placenta. It comes from the word probably rupture, somewhere there. So it's like the placenta is breaking off from the uterus. When it breaks off, or when it is breaking off from the uterus, it will cause bleeding, and therefore a woman will see some blood down. When you see this, rush to the hospital so that you can be managed quickly. It's a danger sign. Another dangerous sign during pregnancy, my friends, is convulsions. Convulsions, or what some people call fits. Fits. Shaking. A woman is pregnant and all of a sudden she's shaking. She's shaking, she gets unconscious. Some of them will even have froth or saliva coming out. They're unconscious, they become stiff, and they're just shaking. That is a bad sign also, a danger sign. And this can indicate a condition known as eclampsia. Eclampsia, I'll talk about it in one of my next videos, is one of the silent killers. Actually, it's pre-eclampsia stroke eclampsia. It's one of the silent killers. It's one of the major cause of maternal child death or mortality. Preeclampsia, eclampsia, they have claimed many lives of women when they are pregnant. This, when you see convulsions, don't wait, there are some traditions where you get convulsions, then they start roasting all, they try to get smoke from, I hear, birds' feathers and so on, trying to smoke here around, trying to put some funny stuffs on you. Issues will happen. Now, this is to the caretakers, the husbands, or whoever is taking care of this woman that is pregnant. The moment you see this woman convulsing, rush to the hospital. It is a danger sign of pregnancy. Another very important sign is severe headache. I understand. By the way, before I leave convulsions, there are some convulsions that are brought about because there are some women that are epileptic. Find a woman has epilepsy, and then they convulse. Also, they can have malaria, severe malaria, or meningitis, because when you are pregnant, malaria doesn't save you. It doesn't run away from you. You will still get malaria, and when it becomes severe, it goes to the brain and you get convulsions, or what we call cerebral malaria. You can have meningitis. There are very many things that may cause convulsions in a pregnant woman, including those ones that can cause convulsions in other people. But specifically for a woman, eclampsia is very dangerous. Even the other convulsions, all convulsions caused by other things. That's why when this woman comes to the hospital, we do investigations very fast. We take off blood, we test for the malaria, we test for bacteria if there is probably meningitis and so on. But of course, we will have taken your blood pressure. We will have taken off your urine. So if the blood pressure is high, and then we check the urine sample, their proteins and so on, we know that is likely to be eclampsia, and you start off immediately with medications. And they include the magnesium sulfate, they include anticonvulsants, whatever, there are many of them, and hypertensives, a lot of drugs. It's a mixture of drugs that are used. Therefore, when you see convulsions, my God, run to the hospital. I'm also talking about severe headache plus blood vision. Now, I understand that a person can get headache, some light headache. Of course, even when you're pregnant, you have some light headache. No, you may not rush to the hospital. But when the headache is severe, and it also causes blood vision. What do I mean by blood vision? You feel like when you look at something, it's not clear. It's blood. It's clear. It's not. You can't focus on a substance. When you look at your husband, you see as if he's having some funny colors. And you have headache. That's a danger sign. Another very important danger sign is severe abdominal pain. Let me tell you, we've always said that there are minor elements in pregnancy. One of the minor elements in pregnancy is abdominal pain. That a woman feeling abdominal pain during pregnancy is okay. Yes, it is okay. But if it's severe abdominal pain, my friend, it's not okay. It can indicate many things. One, it can even indicate that labor is starting. So if the pregnancy is not yet at term, that is preterm labor or abortion, miscarriage. So abdominal pain, severe abdominal pain, it can indicate a UTI in pregnancy. And UTIs have caused a lot of abortions or miscarriages. So severe abdominal pain is a big factor. Don't take it lightly. You know, I usually feel abdominal. Maybe it's ulcers. Maybe it's this. No. If you're pregnant, the abdominal pain is severe, rush to the hospital, go to your gynae, go to your doctor, go to your midwife, sort that out. Another point, difficulties in breathing or fast breathing. Fast breathing or difficulty in breathing. When you realize that your breath are reducing, the breaths are reducing. In our language, in Luganda, they call it omuka or bakamubaki. There is fast breathing and you feel difficult, you feel the chest is tight. Don't wait. Those are already sounding bells. They are sounding, they are telling you to go to the hospital. Don't wait for conditions to get worse. Difficult or fast breathing, hospital. It's a danger sign of pregnancy. Reduced fetal movements. What do I mean? Usually, when a woman reaches 20 weeks, actually even sometimes less than that, the baby starts making movements. They are fetal movements. The woman will tell you, I feel like, yeah, the baby is pushing me. You'll feel the movements. Throughout 20 weeks, 30 weeks, you feel those movements. Now, if all of a sudden you've been getting those movements, you've been feeling the fetal movements, the baby is kicking, and all of a sudden you're not feeling the kicks, you're no longer getting the movements, rush to the hospital. All the movements are there, but reduced fetal movements is a danger sign of pregnancy, which you must be cautious of the moment you realize that your baby is no longer moving very well. When you realize that the baby is no longer kicking you the way it used to kick you, go to the hospital. Another sign, body swelling. You know, when a woman gets pregnant, usually they develop swelling, especially of the limbs, of the legs, and sometimes the palms, the fingers, or the hand. Now, this swelling shouldn't be severe. It shouldn't be severe. When it becomes severe, hospital. And again, even when it is not severe, there are measures. When you come to the hospital, there are maneuvers, there are different techniques we can teach you. Especially, like we can tell you, because most women lie on their back when they are pregnant. You're supposed to lie in the left lateral position. Then also, we usually tell you to put a pillow below your legs. When you're going to sleep, when you're in bed, you make sure that you're sleeping in a tilted angle, at an angle whereby the legs are up and the head is down. What causes this body swelling? It's because during pregnancy is a stressful condition. It causes there are a lot of physiological changes that occur, and the heart may not be able to remove or to pull blood from the lower extremities. Therefore, we aid it by slanting and by putting a slanting angle so that you can sleep when the legs are elevated. Usually, I tell ladies to put a pillow. Instead of putting the pillow on the head, you put the pillow below the legs. And this will reduce the swelling of the legs. Now, If this swelling is severe, legs are swollen, hands are swollen, and even the face is getting swollen, what are you doing at home? Go and check with your doctor. Another point, when you are pregnant and you feel too weak to get out of bed, that is just enough for you to go to the hospital. It's a danger sign. A pregnant woman should not be bedridden. Pregnancy is not a disease. It's just a condition, a little bit stressful. But someone should be able to wake up to do daily core activities. All at a reduced rate, yes, but should be able to work, should be able to do activities at home. Now, if you realize that you've been okay, but all of a sudden you are weak, you don't want to get out of bed, it's a danger sign of pregnancy. You should check with your doctor for a diagnosis, for treatment. If it's your very first time to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important video we upload. And I told you, if you'd like to get in touch with me to have a private chat, a private conversation, go to my website www.druthman.com, book an appointment, we shall chat, we shall discuss, chat a way forward for your problem. And also you can find us on all our social media platforms. The name is Ask Dr. Uthman. I sign out.
Ask Dr. Othman on Masawa War.